Okay, we continue with tongue diagnosis made easy, cracked tongues, part 3. Sa vertical midline crack, a red tongue with vertical crack along the midline and within the center of the middle third of the tongue body is a typical of stomach yin deficiency. So, dun yun po sa my stomach area. This is especially true when the center is dry. A diagnosis of kidney and stomach deficiency is confirmed when, in addition to the midline crack, the tongue body color appears very red and present with either a peeled coating or none at all. So yan po yung kidney and stomach deficiency. In clinical practice, this midline crack is often seen in patients with pale or pale red swollen tongues. In such cases, the pathogenesis is complicated. The swollen tongue body denotes accumulation of dampness, which arises from a deficiency or weakness of spleen chi. So, dahil pag nakita natin swollen tongue, it is because of the weakness of spleen chi, and yun po yung nagkakaroon tayo ng dampness. Spleen and stomach chi deficiency often appears together. Spleen chi deficiency reduces the organ's function of transport. So there is thus lack of transport through the stomach chi. Reduced appetite, meron siyang loose stools or terms of this pathology. Over the long term, however, spleen and stomach chi deficiency can evolve into yin deficiency. So from spleen and stomach chi deficiency, magta-transform siya to yin deficiency. Now, in addition to chi deficiency symptoms, yin deficiency symptoms will also appear. For example, epigastric pain, dry mouth and throat, especially in the afternoon, and intense thirst with no desire to drink. So, yan po yung mga symptoms ng yin deficiency. Meron siyang epigastric pain, may dryness sa mouth and throat. This yin deficiency is reflected in the vertical crack along the midline of the tongue. Okay? If, however, a vertical crack along the midline appears with normal tongue body color and shape as well as normal coating, it can be ignored, especially if the patient does not show any symptoms relating to the functions of the spleen and stomach. So kahit po merong vertical crack sa midline, pero normal yung color ng tongue body or yung shape and having a normal coating, pwede po natin ito i-ignore since ito naman is normal and walang symptoms. This is quite frequently witnessed in adults who, in puberty or early childhood, experience symptoms of stomach deficiency and develop it, but are currently free of such symptoms as their lifestyle become more regulated with the advancing age. So ito yung mga parang sign ng early child in puberty or early adulthood na nagkaroon sila ng mga sintomas, however, na overcome na, but there is still vertical crack present. Another interpretation of this tongue sign can be found in the literature. A pale or pale red tongue with vertical crack along the midline is interpreted as indication of stomach chi deficiency. Okay? So, here, mayroon tayong case ng female, 37 years old. Ang tongue po niya is slightly red and swollen. So, this indicates meron siyang slight kidney yin deficiency with accumulation of dampness. Meron siyang thin vertical crack dito po sa may gitna. So, this indicates meron siyang onset of stomach yin deficiency. Merong white, new, thin coating in the center. Ibig sabihin, meron siyang regeneration of stomach yin and spleen and stomach chi. Meron din siyang slight depression at the root of the tongue. So tingnan po natin yung likod ng tongue nitong picture. Ibig sabihin there is a slight deficiency of essence. Ang symptoms ng patient, meron siyang night sweats, severe exhaustion, meron siyang panic attacks, sore lower back. Sa Western diagnosis, there is none. Sa background to disease, meron siyang severe loss of blood following a traumatic injury to the underside of the leg with subsequent amputation. Okay po. Next patient, we have a female 43 years old. Ang tongue po niya is pale, may slight teeth marks sa sides, which indicates that there is a spleen deficiency with accumulation of dampness. Meron siyang deep vertical crack with small amount of yellow greasy fur. So yan. This indicates that there is a stomach deficiency with accumulation of damp heat. Okay? Ang symptoms ng patient, there is a frequent mucoid stools with undigested food. Meron siyang tenesmus, flatulence, weight loss, no appetite, and fatigue. Sa Western diagnosis, meron siyang ulcerative colitis for 10 years, allergic rhinitis. Sa background to disease, there is a long-standing emotional problems. Okay? So, sa case history, Mrs. F fell ill with ulcerative colitis at the time of great upheaval in her personal life. She was successfully treated with conventional medicine and stayed free of symptoms for 8 years. Her stools then suddenly become soft and mucoid again, and the tenesmus was very painful. This was accompanied by a lack of appetite, weight loss, and a feeling of extreme fatigue. The vertical crack along the midline of her tongue was deep and showed a small amount of greasy yellow coating. The tongue body was pale. Her pulse was deficient and rapid. Sa analysis, Mrs. F suffered for a long time from spleen deficiency that led to an accumulation of fluids and dampness in the middle burner, as evidenced by the pale and swollen tongue body. Dampness is a heavy factor that sinks and in this case gathered in the large intestine and caused the soft mucoid stools. The dampness blocked the upper circulation of qi in the lower burner. This stagnation due to a collection of fluids and dampness produced the abdominal pain and tenesmus. The greasy yellow coating, as well as the deep vertical crack, indicated the presence of dampness and developing heat, which was also reflected in the rapid pulse. So, kinonfirm sa pulse din. In this patient, the heat manifested in the imperative urge to defecate. The accumulation of dampness due to underlying spleen qi deficiency was the dominant pathological factor in this case, because the spleen was unable to adequately transform or transport food and nutrients. The patient suffered from weight loss, fatigue, and lack of appetite. Although the tongue body shows the presence of spleen qi deficiency, the vertical crack with its coating denotes simultaneous presence of heat in the body. The vertical crack along the midline points to severe stomach qi deficiency. The conspicuous depth of the crack warns the developing stomach qi deficiency, which can occur as a consequence of long-standing diarrhea and smoldering heat. Okay? Sa discussion, yung red tongues with deep vertical cracks in their center are indicative of stomach deficiency and developing interior heat. In a pale tongue, by contrast, such a crack may suggest an old healed injury to the stomach yin. Okay. However, it can also denote weakness of the spleen and stomach chi with the possible development of stomach yin deficiency. Okay. Ito po yung stomach yin deficiency or pwedeng healed injury to the stomach yin or weakness ng spleen and stomach chi na magde-develop further into stomach yin deficiency. Okay. So here another case of a female 54 years old. Ang tampo niya is pale and swollen, which indicates that there is a spleen yang deficiency with accumulation of dampness. There is a deep vertical crack sa center, indicating that there is a chronic stomach yin deficiency. Meron siyang rootless, field coating, and depression at the root of the tongue. So kung titingnan maigi yung tongue picture, this indicates that there is an onset of kidney yin and essence deficiency. Ang patient, meron siyang symptoms of severe exhaustion, heartburn, epigastric distension, feeling cold, swollen, hot knee, and metatarsal joints. Sa Western diagnosis, meron siyang rheumatoid arthritis, and sa background to disease, meron siyang diet of exclusively raw, uncooked foods, overuse of anti-inflammatory drugs, and painkillers. Okay, another case of a male, 32 years old. Ang tongue niya is reddish with red edges, slightly swollen. This indicates accumulation of damp heat in the liver and gallbladder. Meron din siyang vertical crack with greasy yellow coating. Indicates presence of stomach yin deficiency with accumulation of phlegm heat. Meron siyang yellow greasy coating at the root of the tongue. Ibig sabihin, accumulation of damp heat in the lower burner. Ang symptoms ng patient, meron siyang back pain with numb feeling in the left leg, inner restlessness, meron siyang insomnia, nervousness, panic attacks, smelly, soft stools, feeling of fullness after eating. Sa Western diagnosis, there is a protruding disc between 4th and 5th vertebral vertebrae. And sa background to disease, alcohol abuse, irregular eating habits, suppressed emotions, too much sitting. Next patient, we have a female 52 years old. Meron siyang pale and swollen tongue, which indicates that there is a spleen chi deficiency with accumulation of dampness and blood deficiency. Meron siyang deep vertical crack and rootless field coating, indicating a stomach yin and kidney yin deficiency. Meron siyang field coating at the tip of the tongue. Kung check po natin maigi, ibig sabihin meron siyang heart yin deficiency. Ang symptoms is severe attacks of fear and panic, feeling of pressure in the head, inner restlessness, cold hands and feet. Sa Western diagnosis, there is none. And sa background to disease, meron siyang mental overwork and menopause. So sa tongue with a long vertical crack in the midline of the a crack in the midline of the tongue is often seen as an indication of stomach yin deficiency. The crack appears in the middle third of the tongue and is very often deep and wide. Constitutional weakness of the heart can also present with a deep midline crack. This crack, however, is much longer than the former. It starts in the posterior third and runs to the tip or just short of the tip. If the tongue body color is pale red or normal, and if the crack is thin, there may be no pathology. So kung ang tongue body color is pale red or normal siya, kahit may crack na manipis, this could indicate no pathology. The crack may simply indicate that there is a possible constitutional weakness of the heart. So pwede po constitutional weakness of the heart, pero at present wala po siyang pathology. If however the tongue body is very red and the midline crack is very deep, so very red, and malalim yung crack, heart fire is probably present. If such is the case, there will also be restlessness, irritability, and palpitation, and mouth ulcers. So yan po yung heart fire. Merong restlessness, irritability, palpitation, and may ulcers sa mouth. If the crack is covered by a yellow greasy coating, phlegm fire is agitating the heart. In this case, the patient will exhibit restless agitation, a bad temper, and manic behavior. So yan po yung phlegm fire, agitating the heart. Finally, a red tongue body with a rootless or peeled coating in conjunction with a long vertical midline crack indicates deficiency of the heart and kidney yin. So mahabang vertical midline crack indicate deficiency of the heart and kidney yin. Constitutional weakness of the heart does not mean an organic weakness of the heart. In those with tongue type, there is a tendency towards a certain kinds of mental or emotional weakness. Frequent attack of melancholy and crying spells, emotional instability, fearfulness since childhood, and depression. However, with an appropriate lifestyle, there may be no symptoms at all. So, pag tinama yung lifestyle, pwede po mawala yung mga symptoms, and great care must be taken, therefore, when assessing the significance of this crack. So, next patient, we have a female 35 years old. Ang tongue is reddish and slightly swollen. There is a slight spleen deficiency, accumulation of dampness. Meron siyang long vertical crack in the center with yellow thin greasy coating. Okay? Indicating a constitutional heat in the heart with phlegm fire in the stomach. Meron din siyang red tip, which indicates a heat in the heart, and white greasy coating, ibig sabihin accumulation of dampness. Ang symptoms ng patient, panic attacks with fainting spells, meron siyang palpitations, severe feelings of fear, diarrhea with emotional pressure. There is none sa Western diagnosis and sa background to disease, long and happy marriage, overwork, and excessive consumption of chocolates. So sa case history, this 35-year-old private secretary complained about her unhappy marriage for 10 years. She did not know how to improve relationship. During this period, her panic attacks occurred more frequently and become more intense. They always started with palpitations, a stifling sensation in the chest, and sudden diarrhea. She often called for an ambulance in these situations, thinking that she had suffered a heart attack. The patient occasionally fainted when the feeling of fear became too strong. She appeared nervous and hectic, but at the same time gave an impression of vitality. There was a long vertical crack on the midline of the tongue, and the coating was thin, yellow, and greasy. Her pulse was rapid and slightly slippery. Sa analysis, the deep midline crack, in this case, which extends to the tip of the tongue, is not just an indication of constitutional weakness of the heart, but also suggests the presence of heat in the heart. So, meron siyang presence of heat in the heart. The red tip and midline crack are covered with yellow prickly coating. This is a sign of phlegm heat in the stomach. So, meron siyang phlegm heat in the stomach. Phlegm heat disturbs the chest, which the patient described as a stifling sensation. Because it is blocked by phlegm, the clear yang cannot rise and thus causing fainting spells. There are two mechanisms at work here. Okay. Number one, meron siyang panic attacks and spells of diarrhea dominating when heat in the heart transforms into fire. Okay. Ang heat in the heart transforms into fire, nagkakaroon siya ng panic attacks and spells of diarrhea. When the phlegm heat is more prominent, causative factor. It will agitate the heart, manifesting chest pain, palpitation, and fainting spells. So, pag meron naman ng phlegm heat, na-agitate yung heart, kaya nagkakaroon ng chest pain and palpitation. Sa discussion, a midline crack that extends to the tip of the tongue is an indication of constitutional weakness of the heart with a tendency to develop heat in the heart. People with this type of tongue tend to suffer from restlessness and are frequently led overactive lives. If this condition is aggravated by phlegm heat, the individual will suffer from inappropriate emotional reactions, which in extreme cases can lead to mental illness. Okay? So, yan po yung phlegm heat. So, another case of a female, 35 years old. Ang tongue po niya is reddish and slightly swollen. This indicates that there is a spleen deficiency, accumulation of dampness. There is also a long vertical crack in the center with slightly yellow thin greasy coating, indicating that there is a constitutional heat in the heart with phlegm heat in the stomach. Ang symptom ng patient is sudden vertigo, trembling of the entire body, numb areas in the extremities, severe feelings of fear, tendency to catch colds. Sa Western diagnosis, meron siyang chronic fatigue syndrome. Sa background to disease, there is a physical and mental demands of competitive sports. Okay. Next case is a female 38 years old. Ang taong is pale red. This is normal. Meron din siyang slightly red and curled up edges, indicating that there is a liver constraint with heat in the liver. Meron siyang long vertical crack in the center. Ibig sabihin, may constitutional weakness of the heart. Sa indentation of the tip, meron siyang heart blood deficiency. Okay? Kung tingnan po natin yung dulo ng tongue, ibig sabihin may heart blood deficiency. Sa depression at the root of the tongue naman, ibig sabihin there is a essence deficiency. Yung yellow greasy coating along the midline crack, ibig sabihin phlegm in the stomach transforms into fire. Ang symptoms ng patient is pain in the jaw, loose teeth, severe irritability, exhaustion, constipation, and thirst. Sa Western diagnosis, meron siyang osteoporosis affecting the jaw. Sa background to disease, meron siyang anorexia nervosa as teenager, meron mental and emotional pressure at work. Okay? So next case, we have a female 38 years old. Ang tongue po niya is reddish, which is normal, and yung meron siyang red edges. Ibig sabihin, mayroon siyang heat in the liver. Long vertical crack in the center with a red tip. Meron siyang heat in the heart. And yung yellow thin greasy coating, ibig sabihin, meron siyang accumulation of damp heat. Ang symptoms ng patient is inability to stay asleep. Meron siyang hot feet at night, occasional night sweats, headaches, tightness of the neck muscles, and black sinuses. Sa Western diagnosis, meron siyang uterine fibroids, allergic rhinitis. Sa background to disease, meron siyang long-standing emotional problems. Next patient, we have a female, 40 years old. Ang tongue po niya is red, swollen tongue body, indicating kidney yin deficiency with heat in the heart and stomach. Meron din siyang long deep vertical crack, indicating constitutional heat in the heart. And meron siyang thin white coating, which is normal. Ang symptoms ng patient is palpitation, anxiety, restlessness, insomnia, fatigue, washes herself all day, and meron siyang nausea and vomiting with agitation. Sa Western diagnosis, meron siyang compulsive neurosis. Sa background to disease, unwanted divorce, and loneliness. Okay? Thank you for your attention.